Hello and welcome to the Pain Free Living podcast with me, your host, Bob Allen. I've been treating people since 2008, helping them get out of pain. I graduated as an osteopath in 2011, and today I'm going to talk to you about hip flexors. Now, when I talk about hip flexors, you're probably thinking, if you know about anatomy, you might be thinking, okay, quads. That's what the quads do. Quads are the muscles at the front of the thigh. Yes, they are a hip flexor. The reason that I thought I'd cover it today is because over the last 6 to 8 months, I have seen a lot of people that are having hip and groin pain because they're having issues with the hip flexor. Now I've got your interest, I thought I'll do a little bit of a dive into the anatomy and how it works. And then hopefully, if you have a similar problem, you'll know what to do about it. So when we talk about hip flexors, we're talking about, well, most of the time we talk about hip flexors, most people know about the quads. The quads are the muscles at the front of the thigh. They go from hip down to knee. I'm pointing, even though you may be listening on audio, but the quads go from hip down to the knee, and they're responsible for when you walk, as the quads contract, it brings the knee, it brings the leg up and forward, and then you put the foot down. So that is the primary hip flexor. But what a lot of people don't realize is that you have two hip flexors. So the primary one is the quad, but actually you have a second hip flexor, which is much deeper. It's so deep, it's almost, it's so deep, it almost runs along the back. It's like it attaches into all of the lumbar vertebrae and discs and the transverse processes of your lumbar spine, of your low back. So the second hip flexor, it's a muscle called the psoas, which is PSOAS, if you want to look it up. And it's a key muscle for hip flexion. If your leg is straight and you lift your leg up, that's the quad. If your knee is bent and your hip is bent, then when you lift the leg up, that's your psoas hip flexor. So it attaches into all your lumbar vertebrae, all the important structures in your low back, and then comes down and attaches onto the inside of your thigh bone. Now, if you have an imbalance between your left and right deep hip flexors, that can cause some problems. People that I've seen with psoas issues, hip flexor number 2, are runners. If you spend a lot of time sat at a desk, that muscle's actually shortened, and then it can exert different pulls on the pelvis. And if the psoas hip flexor has issues, it can be responsible for low back pain, it can be responsible for hip pain, it can be responsible for groin pain, or it can be responsible for all three, depending on how angry and upset that hip flexor is. So if you are getting groin pain or hip pain, you've not got any issues with the hip, you've got full range of movement in the hip, it could be the psoas that's causing the problem. And like I said, the reason that I'm bringing it up is because not a lot of people know about it. And even a lot of physical therapists, and the reason I'm highlighting it is because I've seen 3 or 4 clients over the last few months that have had psoas issues, but they've also had groin pain and hip pain. And one of the people that I have seen, he was training for a marathon. He'd got to the point where he couldn't run because he was in so much pain from his hip. Now, when he came to see me, there's a really, really simple test, which I will probably ping into the show notes on this one. There's a really simple test you can use to see whether it's the psoas hip flexor that's causing a problem or something else. So it's a really easy, really simple test to do. And if your physical therapist knows what they're doing, they will check that as well. If you've got groin pain or hip pain and you've got full range of movement in the hip, they should be checking that as well. So like I said, I'll leave a little link in the show notes to a test that you can do to find out whether that is what the problem is. And yeah, so if you're getting hip or groin pain, it may not be the hip or an issue with the groin that's the problem. It could well be this psoas, the hip flexor. So I hope you found that useful. If you've got any questions, drop them in the comments for me. And yeah, if you found it handy, tell your friends. If you know somebody that has an issue sounding similar to that, let them know that their therapist or their GP may be looking at the wrong problem. And yeah, like, share, subscribe. Like I said, tell all your friends, and I will see you at the next one.